Let us understand your problem.
First, I have diabetes,
Oh,
cholesterol,
cholesterol.
and my left eye have the scar tissue.
You have scar tissue.
Yeah,
Mhm.
and then have the cataract.
Cataract.
The left eye is more heavier than right eye.
Both sides.
Yeah, both
They
sides.
all have cataract.
Yeah.
Okay. That's usually you're fine.
Yeah,
Okay.
thank you.
Cataract, diabetes, cholesterol.
And then
Do
the
you-
scar tissue.
The scar
yeah.
tissue. It's a blurring, no? Scar tissue.
Blurring, a little bit blurring.
Blurring.
Yeah.
So left side eyesight is worse than the right
Yes.
side. Okay. This blurring is from the cataract surgery or no?
I have not surgery yet.
You don't have
But
the surgery.
yeah, I'm checking up. The doctor said that, and he say mine is very light. Just take time to get surgery. Don't hurry.
The scar tissue comes from where?
He didn't know.
You didn't know.
Yeah.
It's just they showed, they tested.
yeah.
Okay. Okay. There's some deposit right there.
Yeah.
Let me see your tongue. Okay. Not much fur, right? But it's also moist, right? But the tip is more red right now. The tip. How is the appetite?
Appetite is normal, but sometimes when I eat something, I have more gas in
You're
my
guessing.
yeah.
Okay, that's a good one. The reason I ask from checking her tongue one more time, is because the center crack, something related the stomach. It's not that bad. That means either she probably eat fast. 你吃东西很快吗？
No.
不会很慢。
不会, yeah.
不会很慢. Or something related to stomach that we have to ask. But when it's cracking so much, my clinical experience is not necessarily the patient themselves drinking alcohol, but maybe parents or even it's hereditary. It's already that kind of alcohol consumption. It's already cracked the stomach, hereditary, got that. And this kind of a patient usually to develop allergic to food, certain food, we don't know what. And even this is still in that speculation level. But whenever I see that kind of a crack, and then when I ask, they have alcoholic parents. Yeah, so that's just people interest could do more experiments about that. Okay, now please lay down. The toe is cold. The toe is cold. The left side is cooler than the right. So left side this is a little nail mark I can't really see because with yeah, but we can hardly see a little bit. So there's no moon. So the body type is cold. Body type is cold. So actually, cold means all the metabolism could be slower. And also indicate the left side, hereditary side, the inside, it is weaker. He's different.
Could being vegetarian lead to the cold?
Yes, that won't help to warm up.
So she needs to
yeah.
eat meat.
Eat some, not necessarily a lot, but you get at least some good protein. But the left side is colder. Yeah. Okay. But no fur. Oh, no wonder if you vegetarian.
Most, yeah. No.
Most of the time,
Yeah.
vegetarian usually the bowel movement is better, so they don't collect the mucus like he has. There's some mucus there. Because a vegetarian also, the fiber already scrape all the waste out of the system. So there's pro and con.
Is eating seafood the same as to warm up the body, or do you need red meat?
Red meat will be warmer, especially beef. A little bit. Just a small piece. A little bit meat. Seafood is good too, but not shrimp. Do you have joint pain?
No.
Yes.
No. Arthritis?
Arthritis, yeah. They say here, this side.
Does that bother you?
Yeah, body.
Does that bother you?
When I sit down or
That
wake
that bother
up,
you?
yeah, it get pain.
Uh-huh.
I found 2 years ago,
Uh-huh.
and
I
then I
see.
got, yeah.
I see.
And some, this side is bigger than the right side from my hand.
You know, we actually, the arthritis, now she just mentioned, because the diabetes, again, we go for lower 3 emperor, right? But look at this. This is a little bit of pathological vein here. Huh? This is also a little bit, this is not as bad, but right here.
Would you bleed it?
We could bleed it. Yeah. If we have it. See, we compare both sides. This side may be a little bit, but not as substantial as this two. Either one. We can go for just one. See, actually, the fact here, this is one. Here's another one. But we're not gonna. Here's another one. 1, 2, 3. We're gonna go for this one. Howdy.
If someone has diabetes, it's okay to bleed.
A little bit. Try to, but if already shows the circulation goes, then yeah, it's just the beginning. I know.
I brought the 3 edge and then the one from yesterday, whichever one you prefer.
Okay, actually the one from yesterday is pretty good, smaller.
Yeah, this one is the bleeding needle from Acumed.
Oh, I see. There's. I need another one. Oh, 对不起啊. That's just preventing from yesterday when it. This one I use, like this way.
Yeah, I do it like that too.
You do it like that.
Yeah.
Usually, I don't like to use this glove, but we must. See, you could see the color. It's pretty dark. When we got a flow like this, 1 point is enough. If it's connected, this one will be subside, some. We really want to see the connection. We just let it flow. You're fine. You're fine. And this is not necessarily kidney. It's already kidney close to spring night. And spring night is good for diabetes, and especially the female patient. The 3 emperor become 3 empress. So we will purposely pick up the spleen point, not like kidney 3 and kidney 7. We did it on him. We won't do it. Instead we will do like spleen 6, 9, or even 7, Probably we just pick up 2. And when it already flowed for some time, so the blood actually wouldn't be as dark. Thank you. It was stop by itself. That's good. When they don't stop by itself, then we usually ask first if are they on any aspirin or those things. And you can see the blood consistency. It's not just lighter.
Watery, yeah.
Yes,
Watery now.
that is the vegetarian effect. That is interesting, and that is vegetarian effect. And one time I also bleed a guy, and it was so thick when he coming out. I said, "Are you eating vegetable at all?" He said, "No, that's meat." We just practice to a point we learn to, watch the difference, observe the differences in contrast, and we know blood is related to food. So this is very clear. Just come to this point, the color is light, and it's a little bit watery. It's already diluted. So yeah, mom, you can have some meat or bone soup. Make some bone broth. That would be better. That would help your blood quality. We're gonna, because a little bit damp, we're gonna place a little more. Yeah. This is okay. This is okay. That's okay. We can change it later. We change it when the treatment, because then it's easy to clean. Don't worry. We let it dry up. Then if you have a Band-Aid or something later on, you just seal it. At least we clean. No, I'm not gonna use it anymore. That's it. That's the bloodletting. Oh, you got a. Oh no. There's a teeny.
No, that's to protect the
Oh,
sharp.
I see. I thought, you finally got a small size needle. Okay. Oh, I don't need this anymore. Spling 6. Is it sore?
No.
You're fine, huh? You're fine. How about this one?
A little bit sore.
Okay. There's one more like 10, huh? The 血海. Is it sore here?
Yeah, a little bit
Yeah,
sore.
yeah. I'm gonna go for this and this.
Okay.
Ah, good. Good girl. That's right? This is a 血海, right? Now, for the eye. we know the liver point will go through the eye. I'm going to see if through 火主 or 火印, which one is more needed. Is it sore?
Yeah, on the top.
On the top.
Yeah.
How about the lower one?
Not that.
Nothing. See, this one go to the brain, the very center, that we
Yeah.
call the cell location of cell identity. This one dealing with emotion a lot. So we, no matter what, people more or less get a little bit soreness. Okay, very good. This one will help the eye. This one, these two will be more dealing with the diabetes issue. There's one more. Dr. Master Tung's point called 4-flower needle. 4-flower needle, 四花中哈. 四花中 is on the stomach meridian, but it's very good for eyeball. So in because there's a scar tissue in the back, so we're gonna find, again, seasonal reason, we're gonna skip the young meridian, so we're not gonna do this one. Otherwise, according to Master Tung's point, we easily go for, because the left eye, we easily go for the right side, right, as the opposite side. But instead, we want this. Is it sore?
Not very.
Not very.
Yeah, it's sore now.
Yeah, so we just be a little bit patient, find it in that area. Because another way of doing it is close your eyes, please. I'm going to press, use this thumb. Do you feel a little bit puffiness?
Yeah.
Okay. Which side worse?
Left side.
It's a little bit puffiness. Now we almost going to challenge the point if this one, same side, is going to help or not. We'll see. I want to make it very adequate. Right? Yeah. Okay. And because it's the scar tissue is behind, we go a little bit deeper. All right. Okay. Again, follow the shape and the depth. Actually, each point, we think this point is going to be many options. If we're going to go deep, or we're going to go, okay, it's actually 得气 from this level. It's not the shallow level. It has to go a little bit deeper. Now, do you feel relaxed now?
Yeah.
Yeah, that's why I just spontaneously close her eye. Again, I'm gonna press. Any difference?
Yeah, this more puppy.
Still feel puffy, right? Still feel puffy. Now let's just go a little bit deeper. And this one. Again, now, any difference?
Yes, better.
Yeah, it is better, like not as puffy.
Yeah.
It's good. 1, 2, 3, 4 points. That's fine. Do I miss anything? Diabetes? Cholesterol?
Sciatica.
Hmm?
She may have a sciatica.
Oh, good. That already we got one, right? So we can make 5 points. Good, thank you. Sciatica, this one, we try to use this as one. This one even is not kidney gate. That we already do some bloodletting here. So the other one is we find the low back sciatica. Hey, interesting. When you feel the pain here, does this pain travel down? Sciatica, the joint arthritis.
Yeah.
Do you feel the actually pain travel down?
Not yet.
Not yet. It's just right there, right?
Yeah.
But now I want to. You are pointing right here. Am I right?
Yeah.
Or, yeah, you're pointing
Here. Yeah.
right here,
Yeah.
right? This is already toward to the gallbladder meridian. So we do have options. Either when it's more on the sciatica point, or the pain travel in front along the stomach meridian, we go for 灵骨大白. But if we see now, it is a little bit toward to the toward to the gallbladder meridian. That's a 少阳. We will go for like triple burner 2 and 3. We locate from there. Is it sore here?
Yeah.
Okay, that's a good one already. How about here?
No.
No, it's more
Yeah.
this guy here. But now, let's just compare this one and 灵骨. Is this bad?
No, not that bad.
See, so we're gonna actually the issue is we should pick up this point. And this, I'm gonna come over here. And this we're gonna, it's just right next to, right?
Yeah.
Right next to the point. The way we feel, this is very similar to the kidney gate that we're feeling. This is right next to the bone. I have options. It doesn't travel too much. I go perpendicular. If it already traveled all the way down, I might, when I insert a needle, I might go this way, go and then thread to 3. So now we just go as if this is like similar to a hand sengguan. Triple burner is a representative or envoy of the kidney. So it helps to spread the fluid all over the sanjiao. So this is going to help the kidney as well, because it is a representative for kidney and kidney meridian. So every time we insert a needle, we try to just think in our mind, we think how it really connected, is actually consistent with the original theory. So like this. So we reach 5 points. Still the left side cooler, huh? 还是左边比较凉，而且 you see why yesterday that lady was so significant, because the moon so big. So once it's sensitized, when it happened, it's more powerful. Oh. Okay.